we are talking about Hatha Yoga. And we have already discussed what is Hatha Yoga. We have discussed asanas. We have discussed pranayam, 8 types of pranayam. And now we are going to discuss Shatkarma, Shuddhi Kriya, or cleansing techniques. Probably you have seen some video or you have done it yourself, putting water through one nose, one nostril, and the water comes out through the other nostril. So the water goes from one nostril all the way into your sinuses and then comes down from the other nostril. Just bend forward and a little angle you need to adjust so that the water goes into the sinuses and then comes down through the other nostril. And then again from the other nostril and out through the first nostril. For example, I am giving, there's so many other cleansing techniques where you eat 15 feet long cloth and take it out. You put tube and bring the water from the stomach out through the tube. Then there's a cleansing technique called Varisara Dhauti or Shankha Prakshalan, where you drink couple of glasses of salt lemon water, do some sets of exercises, then after some time you keep doing this. 2 glasses, keep doing exercise. To drink 2 glasses, keep doing exercise. You have to go to the toilet. So keep doing this till you drink clean water and the clean water comes down, comes out from the bottom. So the whole path from this end to that end cleaned. This is Varisara Dhauti. Then there's some other Dhauti, other cleansing techniques. Now what are these cleansing techniques? What is the purpose of it? Don't think that on the path of yoga there's much more waste products are generated and the bodies of the yoga masters, they produce a lot of toxins. No, it's not like that. The idea is more subtle and more deeper to our physiology. Our body, when it is under stress, which is when it is not in harmony, may accumulate toxins in certain parts of our body. And these accumulated toxins create more and more problems. The idea of Hatha Yoga is to wash out these toxins. Sometimes you are very stressed and then you get cough and cold. Because of stress, there is certain more formation of mucus and toxins and waste products in nasal cavity. And our body is unable to get rid of it. That's when we start having problems. If you do this cleansing technique, you can easily wash out these accumulated toxins. And it will help your body remain good. The purpose of getting rid of these accumulated toxins in the body is to balance all the systems in your body. The state called homeostasis, it's a medical term. Homeostasis is where all the systems in your body are working in harmony and efficiently. They are all efficiently working, they are doing their job. Heart is doing its job, excretory system is doing its job correctly, nervous system is coordinating with every other system correctly. So this homeostasis is a state of balance. And this homeostasis is disturbed if there are accumulated toxins. So idea is, if you get rid of these toxins, your body will be always in state of balance. These cleansing techniques are also known to clean the blockages to the nadis. You know what is nadi? Nadi is a pranic energy channel. The blockages to the nadis are also cleaned using cleansing techniques. What are the types of cleansing techniques? The first type of cleansing technique is called Neti. Neti. Neti is nasal cleansing. First, I am describing the procedure. Pay attention to the procedure. The procedure is quite simple. You make warm water, warm, not too hot, not cold, warm water, slightly more than your body temperature. This water that is warm, you put salt in it. So you make it salty. So the water that you use for Neti has two qualities, warm and salt. Why not very hot? If it is very hot, the skin inside your nasal passage is very delicate. You can easily burn it. Why not cold? Because if you put the cold water in the sinuses, because of the cold, the temperature, the sinuses shrink. Warm water expands the sinuses and does not burn it. Why salty? What if you don't put salt in the water? If you don't put salt in the water will have less concentration than the intracellular fluids. In your nasal cavity, there's a membrane. That membrane, on the other side of the membrane, there is a lot of intracellular fluids in there. This intracellular fluid has some salts in it. Some salts are already there. Sodium is there, some other salts are there, some toxins, waste products are there. So the water is not plain, it's concentrated. If you have plain water, then because of the osmosis, process called osmosis, this water that you're putting in the nasal cavity, which is plain water, that will be absorbed in the sinuses. The cells will pull it in because it has low concentration. And you will have swollen sinuses. So you have to make this water salty, slightly more salty than the water inside your cells, so that this salty water will pull the water from your membrane out. That is cleansing. That's what you call as cleansing. That is why the water has to be salty. How much salty it should be? Test your tear. Your tear will tell you how much salt is there roughly in your intracellular fluid. Make this water slightly salty than that water. Even if it is equal, still okay. But if it is slightly salty, better. But don't make it too salty. If it is too salty, then it will leave the membrane with layers of salt, which will be causing a lot of irritation to you. So too much salt is also not good. Too less salt is also not good. Has to be just right. That is the procedure for Neti. What are the physiological effects of Neti? I just mentioned you what is happening inside the sinuses. It removes the mucus, it removes the accumulated toxins inside the cell membrane. So it's quite cleaning effect on the nasal cavity. Yoga says when the left and the right nostril, when you are breathing in, at any point of time you are only breathing through one nostril. Either it is left and then it changes to right, then again it changes to left, then again it changes to right. These changes keep happening every after 1.5 hours. Healthy person is 1.5 hours, it keeps changing. Most of the times Because of these sinuses, the breathing is not very balanced. But if you keep doing Neti regularly, this practice of Neti brings these nostrils in harmony. And left nostril is Ida, mental energy, mind. And right nostril is Pingala, physical energy, body. So virtually, left, right, when you balance, you're bringing balance between mind and body. Neti is a very powerful technique to bring balance. So Neti is very good in stress. Neti is very good for cough and cold infections. People who get cough and cold often, Neti is very good for them. Neti is very good to strengthen eyes. But certain conditions like glaucoma or some serious infections of eyes, some kind of tumors, some kind of permanent damages, you have to be careful when you do Neti. You have to talk to the doctor. But generally Neti has a good effect on eyes as well. Neti is also good for pranayam practice. It opens up your nostrils quite cleanly. So you can do pranayam in much better way. Those people, now psychological effects of Neti, those people who are anxious and those people who get stressed quickly, easily, Neti helps them. Neti is helpful in depression also. Those people who want to concentrate and they find it hard concentrating in studies or in their work, Neti helps them. There are two other types of Netis. I'm just going to mention them briefly. I'm not going to tell you a lot in details. One is Danda Neti, where you put a tube, rubber tube, into your nostril and push it in slowly, gently, and then take it out through the mouth because it rolls down. That's how the cavity is looking. No, don't. It's okay. Tube is clean. What comes out is mucus, which is inside you. So right now if you feel like, that is directed towards your own body, don't do that. A rubber tube you can handle. What you can't handle is something that comes out. The mucus and what kind of things come out. But whatever comes out is part of your body right now. So why hate your body? Say, why? It's inside. As long as it's inside, it's fine. If it comes outside, not going to help. You have to accept what is inside. If it comes outside, it's actually good because inside then it's clean. So you should feel much happier. So you put it in. That's the reaction. There's another type of Neti which is Sutra Neti. So it's like a thread, like a cotton thread, slightly more tricky, slightly more painful sometimes. The rubber is slightly easier, but it cleanses this part between your nose and mouth that's never cleaned. You never put anything there. Only this Neti, Danda Neti and Sutra Neti clean that. The next type of cleansing technique is called Dhauti. Dhauti is internal cleansing. Now let me make this point very clear. There are many types of Dhautis. Not just one type of Dhauti, but many different types of Dhauti. First type of Dhauti, Vamana Dhauti. Vamana Dhauti starts with V. Vamana Dhauti. Vamana is vomiting. So you drink salt and warm, salty and warm water, about 1.5 liters of salty water, on empty stomach, early in the morning, when you have not eaten anything. And then you stimulate the vomiting reflex and you throw that water out. Vamana Dhauti. Again the reason for the salty water is same. Again the reason for warm water is same. This time this water cleanses your stomach, esophagus, the food pipe, and also trachea, the windpipe, and mucus from lungs also come out. Mucus from lung also come out. This Vamana Dhauti, you should drink enough water, at least 1.5 liter, to dilute the acid in your stomach. If you just vomit out without the water, then this acid that will come up, will burn your throat, will damage your teeth as well. But if you put enough water into your stomach, it will be diluted and then it will have no problem. So in Vaman, you must make sure that you drink at least 1.5 liters of salty warm water. And then use your 2 fingers, cut the nails, put it in your mouth and to the back of your tongue, press there. There is this little switch. If you press it, then the gag reflex is stimulated. And the water comes out. We are all going to do it. It's slightly easier when you do it in a group because of the sounds that go around. This is nothing to do with anorexia and bulimia, let me tell you. Anorexia is when you eat and then you throw out. Bulimia is also after you eat, you throw up. This is not that. You do it on empty stomach, early morning. And in fact, when you do Vaman on empty stomach, you feel more hungry. Eat more on that day when you do Vaman. It's not going to make you put on weight. The digestive secretions, quality of digestive secretions is changed. And Vaman is not every day. Neti is not every day. You don't do Vaman and Neti every day, let me tell you that. Some yoga students are quite big fan of Neti pot. These days there's a fashion. Wear some really branded yoga clothes. Then have these branded yoga mats. Then have these yoga props. And then one Neti pot. Wherever you go, you carry all these things with you. I have nothing to say to the props and mats and clothes. But Neti pot, you don't do it every day. You don't do Vaman every day. Understand why not? Why not to do Neti every day? Have you heard that if you don't use a muscle in your body for a few months, then that muscle becomes weak and it goes into atrophy? Have you heard about it? It's made redundant by body because you're not using it anymore. Now, your nasal passage also have a natural process to remove the mucus. That's how you need to clean your nose, maybe at least once a day. In the morning, probably when you get up, you just clean your nose and get rid of it. If you keep doing Neti, this natural ability of your body to get rid of this mucus goes down slowly. It's different if you provide help to the body once in a week, once in 15 days, then the body is happy. But if you do it every day, the body is not going to make an effort. Body will say, why use this process. Anyway, this guy is putting water in me every day in the morning, so I may not do it. You understand the point? The same is with woman. Your body is not made for vomiting every day. Your body is made for digesting food in this direction, the direction of your peristalsis. That is your regular movement. Woman is against that. Once in 15 days, once in a month, especially when the weather changes, when the seasons change. Winter to spring, or spring to summer, summer to... In India, after summer, the rainy season comes. So, your seasons are different, Indian seasons are different. When the seasons change, it stresses the body and the body produces more toxins. Or if you are stressed mentally, your body produces more toxins. So you should do cleansing techniques then. When your mind is stressed, or your body is stressed because of weather changes. This is one type of Dhauti, Vamana Dhauti. We are studying Vaman Dhauti. The physiological effects of Vaman. Physically what happens? You remove the accumulated acid and mucus from the stomach and food pipe and lungs. This is a very good technique to stimulate your digestive system. Very good technique. To remove mucus from lungs as well. So it's very good for cold. This technique is excellent for asthmatics, people who suffer from asthma. This technique is very, very good. Those who have often throat infections. Just get rid of that mucus and clean it up. This is very good technique for people who get angry. But wait, to the psychology I'll come, but before that, some physiological effects, some more physiological effects. Ayurveda says Vamana is very good for kapha disorders. Kapha disorders, which includes obesity also. So Vaman is quite good for kapha problems. Vaman is also quite good to strengthen the lungs and diaphragm and the muscles in that area. Vaman is very, very good for your thyroid, especially people with hypothyroid. Vaman is quite good for hypothyroidism, and it stimulates thyroid function strongly. Most of the times people put on weight because of underactive thyroid, hypothyroid. So this is quite good technique for them. Psychological effects of Vaman. It's very good for people who get angry, people who suppress emotions and never express themselves. Vaman is very good for them. Vaman is good for stress. Vaman is good for depression also. Depressed people, Vaman is quite helpful. Then there's other cleansing techniques which are coming under Dhauti. First of the techniques is Vaman, I told you. There's another technique called Varisara Dhauti or Shankha Prakshalan, which I have already mentioned. So you drink couple of glasses of salt, lemon and warm water. Perform sets of exercises. There's about 6 exercises given by Swami Satyananda of Bihar School of Yoga. Very nice, logical exercises that Swamiji has put together. And these exercises, you do it, and that pushes the water down. Instead of you throwing up, the water is pushed down into the intestines and then colon. So you keep doing this process till you drink clear water, and clear water comes out through your bowels. That means that this end to the other end, the whole tract is clean. Then there is another Dhauti, which is called Danda Dhauti. So where you put the tube in the stomach from outside, a rubber tube, and then you have little bit of normal water also you can drink, but salt water is good. So you drink salt water and remove it through the tube. When you put the tube in, that stimulates your vomiting reflex. But you suppress that vomiting reflex in this cleansing technique and still contract the abdomen. This is giving you quite a stronger control over your muscles, abdominal muscles especially, inner muscles which support your stomach and all these internal organs. And then you remove that water through the tube. There is another technique called Vastra Dhauti, where 15 feet long cloth, just 2 inches wide, cotton cloth, pure cotton cloth. You eat slowly. Keep the end at least 1 foot out. If you eat it all, then it's a problem. Some people think that you eat it from this end and from the other end it comes out. It never happens like that. People think, that's not how it works. You eat 15 feet long cloth, keep 1 foot out, and then very slowly take it out, pull it out. And that cloth absorbs all that mucus and it brings out so much. This is an excellent technique to remove mucus. Very powerful cleansing technique. You have to control your gag reflex because you keep vomiting. You have to stop that. In woman you stimulate vomiting, here you stop vomiting. So you are trying to interfere with your nervous system here in cleansing techniques. Pay attention. Very interesting aspect. There's one more cleansing technique that you are going to learn. This you are not going to learn. Danda Dhauti, the tube, and Vastra Dhauti, the cloth, you are not going to learn that. The master cleansing also you are not going to learn that. We will teach you partial master cleanse. But you are going to learn one more technique called Agnisara or Vannisara. 2 names, Agnisara or Vannisara. Both means churning the fire technique. So what you do is you stand in this Udyanasana position. Raise your shoulders up. So you can put the weight of your upper body on the shoulders. Relax the abdominal muscles. And then move your abdomen in and out fast with breath hold outside. So you're not breathing in and out. There's no breathing involved. Just the movement of your abdomen. Very powerful technique to stimulate digestion. Very good for liver problems. Very good for diabetes. Very good for weight loss. Very good to stress your, make the kidneys also stronger, more efficient. This technique is so powerful to lose the fats in this area that if you do it just 100 times, just 100 strokes, in, out, 1, 2, like that's 100. In, out 1, in, out 2, in, out 3, in, out 4, like this 100. It takes only 2 or 3 minutes. If you do this every day, when you are having nothing in the stomach, empty stomach, every month you will lose 2 to 2.5 centimeters here, till you become flat. Try it out. And then whatever you eat doesn't make any difference. Technically speaking, this will change your habits. Slowly you will start preferring healthier food. Everything changes. It changes the whole metabolism. So this is Agnisara. These are the Dhautis. Then the next type of cleansing technique is Basti, called yogic enema. Enema is you put the water in the rectum through the anus. You put the water in the rectum and then flush it out. Hold it for some time and flush it out. This yogic enema is cleansing of your rectum. It's very good for constipation or IBS, all these problems that we encounter. Ayurveda recommends enema with oil, sesame oil, to help with joint pain, spinal problems, because enema is very good for vata disorders, vata problems. This is enema, Basti. Then the next technique is called Nauli. Nauli is a cleansing technique. Concentrated on abdominal region again. So what you do is you do this position of Nasal, and then you move your abdomen. I can show you a bit, but this is not a right time. My stomach is empty, so I can show you. This is called Nauli. This is a cleansing technique for entire digestive tract. Also your small intestines, pancreas. It's a very powerful technique that stimulates your liver, pancreas, even kidneys, lower abdominal organs, which as reproductive glands, prostate, ovaries. Very, very strong technique. Then the next technique is called Kapalabhati. Kapalabhati is actually a breathing technique, but it is not put under pranayam. Kapalabhati is put under cleansing techniques in the ancient books of Hatha Yoga. Though it's a breathing technique, pay attention how to do this technique. Sit up in a meditative pose. Inhale normally and exhale forcefully. And the speed is also quite high. The speed goes up to 120 forceful exhalations in a minute. Generally you exhale 15 times and inhale 15 times in a minute. You are increasing that speed and you are exhaling forcefully. But there is an inhalation in between, which is just like without efforts. So the exhalation is with efforts and inhalation is without efforts. If you want to forcefully exhale, you have to use your diaphragm, the muscle of respiration. So the abdominal movement takes place. Strong abdominal movement is taking place. But this is not like Agnisara. In Agnisara, you exhale fully and just move the abdomen in out. Here you are exhaling and inhaling with every round. There you are not inhaling, exhaling. You are just moving abdomen. Here you are exhaling forcefully, inhaling normally. This is a unique breathing technique for your nervous system and brain. Pay attention why. When you are inhaling normally, your brain has to actively use the muscles. And when you exhale, the brain can relax the muscles. So inhalation is active and exhalation is passive in your normal breathing. In Kapalabhati, you reverse that. Inhalation is normal, natural, like without efforts, and exhalation is active. I'm using my core muscles to exhale forcefully. Some people these days say that you don't use core muscles to exhale forcefully. That's wrong. You cannot exhale forcefully if you don't use your core muscles. I'm talking about physiological facts. You cannot do that. This technique, what it does is it actually removes the accumulated toxins from your lungs. Sometimes the particles, some gases, some kind of toxic things get stuck. Sometimes the small alveoli, they are blocked. This is a unique technique which can clean that. This is also very, very good technique for removing the problems with your thyroid gland, like helping you with the thyroid gland. Again, hypoactive thyroidism, this is a good technique. But the meaning of word Kapalabhati, understand, this is very interesting. Kapala is this part and Bhati is shine, like clean. So cleaning of this part. So Kapalabhati talks about cleaning of frontal lobe. Means it can clean your mind of thoughts. If you start doing Kapalabhati, there will be no thoughts. You will clean your frontal lobe. So this is a good technique, especially for people who think too much. Especially those people who are depressed. This is a very good technique. This is a good technique for people having asthma, respiratory problems, people who have had pneumonia and they have weak lungs. This is a very good practice to strengthen those lungs. This is a good practice to stimulate your digestion also. It concentrates your digestive energy. Good practice to also help with removal of toxins from blood. Because of 120 times you breathe in a minute, the rate of exchange of gases and whatever nutrients and toxins in the blood and in the lungs, it also is increased. So your body is flushing out the toxins, especially carbon dioxide is washed out. That's why sometimes if you do too much Kapalabhati, you may feel dizzy, because the carbon dioxide falls really, really low. And when the carbon dioxide goes low, your blood vessels also constrict. And because of that, your blood supply to the brain is affected. So sometimes if you do too much Kapalabhati, then you may feel little dizzy. What to do after that? Just hold the breath for a few seconds, 10-20 seconds, and you will be back to normal. Because when you hold the breath, the carbon dioxide will increase fast and you will be okay. Kapalabhati increases the body heat. Yoga says it increases the body heat. It's a heating practice. So this Kapalabhati can easily burn fats. So it's very good for kapha problems. Obesity, weight gain, this is a very good practice to lose that weight. And the last technique after Kapalabhati is Tratak. It's called cleansing of eyes. What is the procedure? How you do it? Process. You sit in a meditative pose. At your eyesight level, about 2 to 3 feet away from you, on the wall, you put a small dot, very tiny dot, maybe black, maybe red, and without blinking, keep looking, without blinking, keep looking, as long as you can. The eyes will be strained. There will be a lot of stress on your eye muscles. a point will come when you will not be able to control, like, and you will have to blink the eyelids, or the water will start coming out. You can do small rounds, say 10-15 seconds round. Look at it to start with. Look at it for 10 seconds. Then blink your eyes. Palming, nice gentle palming. Touch this soft part to the bones here and gently press inside. If you touch this part to the bone, then you are not going to press into the eyeball hard. So take a support and this gentle support, gentle massage, just to release that extra pressure. Then splash cold water on your eyes. But do it within your limits. Don't overstress, because the eyes may start hurting next day. If you don't do this palming and cold water, then you may have your eyes hurting the next day. The same Tratak can be done on a dot, which is called Bindu Tratak, or it can be done on a candle flame, which is called Jyoti Tratak, candle flame, or it can be done on a rising sun, not the sun at noon, rising sun, just for 7-8 minutes after sunrise, or just 7-8 minutes before sunset. This is when the sun has reddish tinge. When the sun has reddish tinge, you can look at the sun. It's a very powerful technique of Tratak. Tratak purifies your eyes, but it also brings concentration of mind. Tratak is also very good to stimulate the pituitary gland. Tratak is also very good for stress. Tratak is also very good, especially Tratak on rising sun or setting sun is very good for depression. Tratak on moon is very good for people who get very angry. If you want to increase your willpower, Tratak on the candle flame is very good. Increase your willpower. Tratak on the candle flame. So these are all the cleansing techniques. Hari Om.